Dr. Baliga here. This is hot off the press news that low-cost dexamethasone reduces death by up to 1/3 in hospitalized patients with severe respiratory complications of COVID-19. This was released by Oxford University news release. The study is the recovery trial. The recovery trial is an acronym for randomized evaluation of COVID-19 therapy. The trial was started in March of 2020. It's a large randomized control trial of possible therapies for patients admitted to hospital with COVID-19. Over 11,500 patients have been randomized to the following treatment arms or no additional treatment. 1. Lopinavir ritonavir, commonly used to treat HIV. 2. Low-dose dexamethasone, which is a steroid. 3. Hydroxychloroquine, which has now been stopped due to lack of efficacy. 4. Azithromycin, a commonly used antibiotic. 5. Tocilizumab, an anti-inflammatory therapy given by injection. And 6. Convalescent plasma, collected from donors who have recovered from COVID-19 and contains antibodies against SARS-CoV-2 virus. The trial was established as a randomized clinical trial to test a range of these therapies, including low-dose dexamethasone. Over 11,500 patients have been enrolled from over 175 NHS hospitals in the UK. On the 8th of June, the recruitment to the dexamethasone arm was halted since the view of the trial steering committee, adequate patients had been enrolled to establish whether or not the drug had meaningful benefit. A total of 2,104 patients were randomized to receive dexamethasone 6 mg once a day, either by mouth or by IV injection, for 10 days, and were compared to 4,321 patients randomized to usual care alone. Among patients who received usual care alone, 28-day mortality was the highest in those who required ventilation, 41%, intermediate in those patients who required oxygen only, 25%, and lowest among those who did not require any respiratory intervention, 13%. What did they find? Dexamethasone reduced deaths by 1/3 in ventilated patients, rate ratio 0.65, 95% confidence interval 0.48 to 0.88, p-value was 0.0003, and by 1/5 in other patients receiving oxygen only, 0.80 rate ratio. The range is 0.67 to 0.96, and the p-value was 0.0021. There was no benefit among those patients who did not require respiratory support. Rate ratio was 1.22, range confidence interval from 0.86 to 1.75, and the p-value was 0.14. So what do these numbers mean? Based on these results, one death could be prevented by treatment of 8 ventilated patients, or around 25 patients requiring oxygen alone. Given the public health importance of these results, the investigators released these preliminary results and are working to publish the full details as soon as possible. Overall, dexamethasone reduced 28-day mortality rate by 17%, rate ratio 0.83, confidence interval 0.74 to 0.92, p-value was 0.0007, with a highly significant trend showing greatest benefit among those requiring ventilation. Test for trend, p-value less than 0.001. The key important finding is to recognize that these investigators found no evidence of benefit for patients who did not require oxygen, and they did not study patients outside the hospital setting, and follow-up was complete for over 94% of the participants. The recovery trial is conducted by the Nuffield Department of Population Health in partnership with the Nuffield Department of Medicine at Oxford. It was supported by a grant from the University of Oxford, from the UK Research and Innovation and the National Institute for Health Research UK, and by core funding by the National Institute for Health Research Oxford Biomedical Research Centre, the Wellcome Trust, the Bill and Melinda Gates Foundation, the Department for International Development, Health Data Research UK, the MRC Population Health Research Unit, and the National Institute for Health Research Unit for Clinical Trials Support Funding. The recovery trial involved thousands of doctors, nurses, pharmacists, and research administrators at over 175 hospitals across the UK, and was supported by staff at the NHS, the National Institute for Health Research, the Public Health Programs in Scotland and England, Department of Health and Social Care, and the NHS in England, Scotland, Wales, and Northern Ireland. The chief investigators for the trial mentioned in the press release included Peter Horby, Professor of Emerging Infectious Diseases in the Nuffield Department of Medicine, University of Oxford; Martin Landray, Professor of Medicine and Epidemiology at the Nuffield Department of Population Health, University of Oxford. So the key takeaway based on these results: one death could be prevented by treatment of around 8 ventilated patients, or around 25 patients requiring oxygen alone. And is important, they found no evidence of benefit for patients who did not require oxygen, and they did not study patients outside the hospital setting.